Hello and welcome to today's episode of PHI, Public Health Impact. I'm Cham Dallas.
And I'm Phaedra Corso, and today's show is like none other we've presented to you before. We are on location in Dublin, Georgia at Fairview Park Hospital, and we're going to be taking you through a decontamination exercise that's being conducted here at this hospital and several other hospitals in the region.
This is a great opportunity to show you what really happens in the event of a disaster. We want to thank Fairview Park Hospital, for their allowing us to bring this to you and give you a little glimpse into the future.
It's really important for us to see exercises like this being conducted here at home because we've been confronted with so many disasters recently, particularly the tsunami in Japan. So we all are a little bit concerned about whether we're able to handle the capacity of such a disaster here on our own land.
Well, I just got back from Japan and seeing that earthquake and tsunami, and I can tell you it is important, it's critical for the hospital systems here to be able to prepare for these kinds of disastrous events in case we have something like that, for instance, from a tornado or a chemical spill.
And Cham, it's significant that you mentioned chemicals because in Georgia, chemicals are on our roads and our trains every single day, and most of them arrive safely to their destination, but that's not always the case.
Yeah, definitely. And the consequences of contact with a chemical, if you had one spilling out of a train or a tank car, can range from mild irritation to sickness, all the way to death. In 2005 in Graniteville, South Carolina, there was a major release of chlorine gas that resulted in several deaths and hundreds of people flocking to nearby hospitals.
And Graniteville is only 10 miles from Augusta, Georgia, so it really brings home how important this topic is for us to consider here in our state. And the whole idea of decontamination is so that we can minimize the damage both to ourselves and to the environment.
And that's the basic purpose of decontamination, removing these chemicals from our bodies, from the sites around us, from clothing, equipment, and to prevent adverse health and environmental effects.
So in today's show, we will see a decontamination exercise, and Cham will be interviewing several of the hospital officials who are involved in the exercise.
And you'll have the opportunity to see Phaedra, our own Phaedra Corso, suiting up in a hazmat suit. And we'll see how these decontamination teams protect themselves and stay safe as they treat those in need of assistance.
All right, here's the information that we've got so far. It was a train collision right up the road from the hospital, some type of tanker spill, chemicals being released, but we don't know what type, and they said victims are on the way. They called the ambulance, but a lot of they're self-transporting too, so we have got the hospital in lockdown, so any victims that showed up would be diverted to the back here. Maintenance has got a tin up and going, hot water heaters going.
With me now is Dr. Kurt Harris, Assistant Research Scientist in the Institute of Health Management and Mass Destruction Defense at the University of Georgia. And he's the exercise director for this exercise, this regional and hospital exercise here in Dublin, Georgia. Why don't you tell us a little bit, Kurt, really about what's the overall plan here, this regional exercise and this local exercise here in Dublin?
Today's the culmination of 8 months of planning that has occurred here in the RCH Region H in the state of Georgia. We've had training exercises, we've had planning exercises, and today is the actual full-scale event that we're going to be doing all across the region. There are 9 hospitals that are participating from Region H today, and we're here at Fairview Park in Dublin to test their ability to respond to a chemical event. Fairview Park has a large train system that comes through here, and they have a lot of rail cars and they carry a lot of nasty chemicals. So they're simulating that they've had a train wreck with a rail car that's leaking methyl ethyl ketone out of one of the cars that have wrecked, and some of the residents nearby have been contaminated by this chemical, and they're going to show up by self-transport and by EMS transport.
And the people don't know what's coming. This is like the real world where they don't know a disaster is coming.
That's correct, and we learned from the Tokyo sarin attacks that about 80 to 90% of people actually show up by self-transport. So what we've done is we're simulating our victims coming to various entrances at Fairview Park Hospital to make sure that their security knows how to recognize these patients and so that they can direct them to the tent without contaminating their facility.
You're a faculty member at the University of Georgia. You're a teacher here to evaluate and to see how well they're really going to do. What are you looking for when you're evaluating them?
The main thing we're looking for is safety issues, any kind of safety concerns we may have. You can hear the generators that are running in the background, making sure there's no electrical lines in this water that we're using to decontaminate these patients. Also, making sure that they suit up correctly, making sure that the people in their PPE, personal protective equipment, are safe, they're taped up, they have their appropriate gloves on, they have their appropriate pappers on, making sure their papper filters aren't upside down, because it's real easy to do to put that belt on the wrong way. Making sure the caps are taken off the filters. Those are some of the main things that we're looking for to make sure basically that everyone stays safe so that we don't add another victim that was a responder.
How does this relate to what you do every day as a faculty member at the University of Georgia?
Well, we've gone through all the planning steps, and so we're here today, and we've done all their trainings that they need. And so today we're going to see what their actual response is, what their capabilities are to put up their tent, what their capabilities are to suit up their team members efficiently and safely, and what their potentials are to decon someone in this tent while maintaining safety procedures throughout the course of the day's events.
So really, you're kind of like a faculty member here, and you're testing them. This is like a test, isn't it?
It is, and today's real interesting because maintaining 9 exercises when I'm only at one location can be difficult, but we're here and it's a good time, so we're looking forward to it.
Well, this is all about readiness, though. The overall picture is we're trying to raise that readiness for when these events really do happen here.
Absolutely, and that's the main goal of what we do here is we want to improve the Georgia communities and the hospitals to be able to respond to whatever event may come their way. And that's why we're here, is to do the greatest good for the greatest number that we can.
Well, thank you, Kurt.
No problem.
Well, I have with me the CEO of the Fairview Park Hospital here in Dublin, Georgia, Mr. Don Avery. Now, we all know how important exercises are to prepare for the unexpected. What's going to be going on here today?
We're involved in a community-wide exercise to, I guess, put into practice all those things we've learned in training. It's important that we are prepared to respond to a disaster. First of all, our accrediting body, the Joint Commission, insists that we do at least 2 of these exercises a year. But it's not just for our good, it's a community-wide exercise. It involves other healthcare organizations, it involves emergency medical response teams, both in our county and the surrounding counties. Fairview Park Hospital is the largest healthcare provider in this part of the state, and so we really serve a 10-county area. It's important that we can respond effectively in a disaster, not just to take care of people here, but those around us as well.
You know, from an executive point of view, from the hospital administration point of view, these exercises are going where you don't normally go. What do you really learn from these?
Probably the most important thing for us to learn from these exercises is the communication between the agencies, the coordination of services. We typically see over 100 patients a day in our emergency department, but in these disasters, you'll see a high number of patients in a very short amount of time. So the communication between the services, the communication between all the different agencies that are responding to that disaster is critical. The coordination of the teams, the coordination of the staff to make sure we get the patients where they need to be to get the best care available. Those are critical things that we learned during these exercises.
Well, we have a lot of hospitals involved in this today, and it looks to me like in the preparations, your team is looking good and preparing for the unexpected we're going to send your way today.
Well, regardless of what that disaster might be, it could be a chemical spill, it could be a weather-related disaster, it could be a serious series of automobile accidents or a train or an airplane, whatever that incident is, we have to be prepared. And we can train as much as we want, but it's real life exercises like what we're doing today that will show if we're prepared or not in the event of a real emergency.
Two at a time. Two at a time. I'm going to get you all cleaned up. Get cleaned up. So take you and you can follow me.
All right.
Come on, sir.
There you go.
Have you already scrubbed off? He scrubbed it. All right, yeah, you want to slow down and rinse good. Scrub!
Now joining me is the hospital's EMS coordinator and emergency manager, Bo Drinkard. Well, Bo, you've got some patient decontamination going on back here. Is this something that's typically done in a hospital?
It is not typically done. We're doing this today so that we can practice our skills, and we can take patients that present to the hospital that have been exposed to some type of substance, and we can get them where they're clean enough to come into the hospital so we can give them further treatment.
Yeah, I remember about 15 years ago, there was an incident in Tokyo, Japan, where there were hundreds of patients contaminated with sarin gas, that's a nerve gas, in a terrorist attack. And there was no decon. They came right in the hospitals. In one hospital, 6 out of 7 doctors was on the ground, shaking with the same effects as the patients. And that's what we're trying to avoid here, isn't it?
That is. By taking the dirty people and turning them into clean patients, we can get them into the environment of care and get them the health care they need.
Well, thank you, Bo. I think this helps us get a real good idea of the amount of planning and the amount of training that's necessary to deal with the unexpected. Now we're going to talk to Allison Jones, who's the emergency department director here at the hospital. You know, we're going to have a great big exercise here today, Allison, and I was just wondering, have you had any real events on this scale before here?
Actually, we have. About 20 years ago, we had an event where a tanker truck collision here in the county, and we received a couple of patients from there. And I have to tell you, there was a lot of opportunities for improvement that we learned back then, so we're much more prepared now. More recently, we had an incident here in town in a local business where there was an unknown substance that was found in the business, and a couple of patients had started having symptoms, and a hazmat team was called out. So we received 6 patients from that event.
So these really do occur. These hazardous chemical events, they're coming in all the time. And I guess the key is that we're going to be ready, or you're getting ready for whatever comes along.
That's right.
One of the most important functions in a hospital exercise is the position of evaluator, the person that kind of takes notes and sees what was done right and what could be improved. Today we'll talk, one of our evaluators was Whitney Kazregas, who's a master's student at the University of Georgia and getting a disaster management certificate. Well, Whitney, tell me, what's the evaluator function? What do you hear doing?
Well, the evaluator typically just takes a lot of notes about what's going on during the exercise, writes down what time things happen and occur, as well as take notes about strengths of the exercise, as well as recommended improvements that participants in the exercise can take note of afterwards, and then use those in the future for a real-world event.
Well, it was certainly interesting being an evaluator in a decontamination exercise. That was different, wasn't it?
It really was. It provided a lot of opportunity for both the participants to see how it would work with maybe a chemical spill, and then also for evaluators to watch them in action.
Well, thank you, Whitney, and we'll see. This is the future of disaster exercises. Thank you.
Thank you.
The exercise in Dublin today is part of a statewide system of exercises to raise the overall level of preparedness throughout the state. And the man in charge of this with us today is Matthew Crumpton, who's the Healthcare Community Training and Exercise Coordinator within public health, within the Department of Community Health here in Georgia. Matthew, we got a big exercise. Why don't you talk about how this fits in throughout the state today?
Over the past several years, we've been working with the hospitals to be more prepared, regardless what the scenario would be. Today's exercise obviously involves hazardous materials, but we're also doing regional exercises around the state, currently dealing with hurricane evacuation, dealing with pandemic flu, and also chemical contamination in other areas of the state of Georgia also.
So this is actually a federal program that oversees all of this through the Assistant Secretary for Preparedness and Emergency Response, ASPR. And this federal program then comes down through the state, and that's what you're managing and monitoring.
Correct. Underneath Health and Human Services, the ASPR program provides funding for the states to help their healthcare communities be more prepared, regardless what the disaster may entail at the local community level. And this exercise series, actually started back several months ago through the planning and preparation with not only this hospital, but other hospitals in the region. And also through our office, we also provided hazardous material contamination training so that they would be able to wear the protective suits and be able to know what to do in a decontamination environment.
So we have the federal funding and the state management, but it all comes down to a disaster and its management at the local level. As we promised earlier in the segment, we're going to now look at donning the entire protective safety gear. We're going to use Phaedra Corso, our co-host, to demonstrate this. And we're going to have our gentleman that we interviewed earlier today, Kurt Harris, the exercise director for today, Matthew Crumpton, who's in charge of the state exercises for the state. And as you can see, this is a lengthy process. Now, you saw these same suits, or very similar suits, going on in the exercise earlier today. However, you might be surprised who some of the people are that actually don these suits.
Right. Really, the people that would end up wearing these protective suits will be people from environmental services, the laundry, people who can stop doing their normal day-to-day job when a disaster happens and be able to respond. It's really important that the nurses and doctors know about it, but they're not the ones wearing the suits because they've got to be the ones to take care of the patients after the patients get decontaminated.
That's right. Most people probably think it's doctors and nurses in the suits. It's really not. It's all sorts of folks. So you're working on the boots there, yeah.
Yeah, the important thing is it's not going fast, it's also being safe and doing this in a proper way. And so we're following the proper procedures that have been taught in decontamination classes. And some of the important things to note here is that we're actually putting the suit on the outside of the boot, so as the water runs down when you're doing decontamination, water won't actually run into the boot if you were to not get a good seal on the tape. So it's very important that we get all these taped up, we tape all the creases, all the crevices, and we make sure that no water is going to get through these chemical protective clothing.
It also keeps any chemicals that are in the air also from depositing and getting in there.
Some other things to notice Matthew's leaving a tab on this tape, so when the event's over, it's easy to get the tape back off towards the end. So Phaedra, just stand up and we'll put your arms through. Begin to zip you up.
Yeah, it looks good.
Okay, let's stop right here, and we'll just put on the first set of gloves.
And you can keep jewelry on the inside?
Typically, you would take it off because we want to make sure that we. Oh, I got your own backwards again.
Although some people might be afraid of losing their jewelry, but typically you would take jewelry off, yes.
This is an inner layer glove, and we'll put overlayer gloves over this.
Yeah.
So this way she'll have some protection once she gets part of her suit off.
It's a process called double gloving. So if there's a problem with the outside glove, the inside glove will still protect. The hands are where the problems are.
Typically in this too, you would also have a silver shield glove, which we're not actually demonstrating here today, but it's another pair of gloves. So you can imagine the loss in dexterity that you actually have in your fingers when you have 3 sets of gloves on to be able to decon somebody.
So double gloving, very important to protect the hands from where the chemicals are going. Now, in the instance where there's medical care to be delivered, this would be challenging, to say the least. Now, this level of suit, you're probably thinking, oh, looks like a pretty high level protection. It's not. This is level C, which is pretty low down. There's A, B, C, and D, and this is actually one of the lower levels of protection that lacks a lot of the air protection that you would have. So most people think of level A, frankly, with the Darth Vader kind of a feel to it. But this is actually a lower level, and what we found is this level of protection, level C, is going to do it. After a lot of experience with hazardous chemicals, this is probably the level that you would have. When I spent 10 years at Chernobyl, it was level C or level D. It was even lower.
And so what is it they just
This
put on
is the respiratory protection that she's going to have for this event. And what we're using is a powered air purifying respirator. We abbreviate it as a PAPR. And notice she has 3 NIOSH filters here on the back that'll filter all the contaminants out of the air if there were to be any. And what happens is when you turn it on, it pulls air through these filters and supplies air to her in her PAPR hood as she's in there decontaminating the patients. All right, one thing I want to notice before we actually slip this on is there's actually 2 sections to this, and we have to make sure that this piece goes inside of her suit to make sure that she's getting all the air that she can while it's turned on. So,
You can't help but think of a knight being put with the armor on back in medieval times with this. Yeah.
Sorry.
And like knights would go into battle, a person donning these suits is, in a sense, going into a hazardous environment, at least. But in the old days, it was arrows and maces and swords. Now it's toxic chemicals.
And now we know that we have it on correctly because you can see the air
Yes.
going in and out of the hood there, and it's actually puffing you right in the face.
Yeah.
And so after we get that, then we zip it all the way up to the top, which I think it is now, and then we're ready
Okay.
to go.
This person Phaedra is now ready to go into action here. And you can see that it's a lengthy process, though, and taking it off is even more lengthy than getting it on. Well, thank you, Kurt and Matthew, and especially for you, Phaedra. I don't know if you can hear me in there, but this is the public health of the future. So, all kidding aside, this really is the uniform of the future, with terrorist attacks, with the increasing industrial nature of our society. This is how healthcare will be done. So, well, thank you, Kurt and Matthew, and especially our knight in green armor, Phaedra. This is where we're going. Well, that was quite an exercise, a big exercise, and the decontamination in those suits was a very compelling part of it. And speaking of suits, that was a compelling activity of you in the suit, too, I have to say.
Yeah, I really enjoyed putting this suit on. I've never done anything like that before, and I was amazed at, number one, how hot the suit was, and I'm very glad we were inside when I put it on. But the other thing that struck me was you can't hear a thing because of the air that's going through that compressor. So how do they deal with that in regular situations?
Yeah, they're not used to it. They're in healthcare, they're used to, operating in the regular world, and yeah, we've had to come up with some ways of communication in those suits, also monitoring how hot people are getting in the suits. And we have a way of guessing who's about to pass out on those things.
And so the other thing that struck me too is you've got those double sets of gloves on. How do the healthcare providers even do what they're supposed to do, like give you fluids or take blood or whatever? I mean, how do they actually use those gloves in real time?
It's not easy. It's a struggle, and that's why we're doing these exercises. In fact, right now, apart from us, they're over in the hot wash, where they get all of the people from each hospital together separately, and then they have a hot wash, everybody together, while everything's fresh on the mind. We'll talk about the things that went right and maybe things that need a little improvement.
You know, one of the things that struck me, Cham, about the whole exercise today was how important it was to have really good collaboration and communication to effectively manage the disaster.
Well, that's one of the successes, at least we can point to in disaster preparedness, is we made a lot of progress in decontamination. 10 years ago, there were very few hospitals that could do this, and now there's a lot of them that can. All of them have at least some familiarity, and like we saw today, some hospitals are doing really well with it.
Yeah, and I was thinking too about the suit. Can you imagine if you were experiencing a disaster for the first time and having to put that suit on for the first time in the actual disaster? It must be a real challenge. So I'm very glad that these exercises are occurring across the state.
Now that's, I guess the point is, we better do it now because these things are coming later.
We'd like to thank all of our participants today, and especially the staff at Fairview Park Hospital. And we'd also like to thank you for tuning in to our show, Public Health Impact.